You're listening to RX Report, the show where you get your health, your news delivered. I'm your host, Manuel, coming to you from the home of pharmacy at the American Pharmacists Association in Washington, D.C. I've got a very special episode for you today. We are again joined in the studio by Bridget Groves. She is our Vice President of Professional Affairs here at APhA, and she's here to talk to us about a lot of the kind of back and forth craziness going on between the FDA, ACIP, and everything else around immunizations. So, be sure to click that like and subscribe button, leave a comment on anything and everything that I, or more likely Bridget, says today, and let's dive in. Bridget, thank you so much for coming back to the studio. Honestly, every time you do, I'm more and more surprised. I just figure that I scare you off with each and every iteration that I have you in the show. But thanks again for coming.
Appreciate being here, Mason. You haven't scared me off quite yet. I welcome the challenge and the opportunity to work with you and to engage with our audience.
I appreciate the quite yet asterisk in that statement, but I'll take the win for what I can. You're obviously very in tune with what's happening in D.C. right now. We have the FDA releasing new approvals for who is indicated to be receiving a COVID vaccine. Previously, anybody over 6 months was allowed to get this vaccine. Now it's completely flipped on its head where you have to be over 65 or have an underlying health condition. So tell me, what really are your thoughts here around this new big change?
Yeah, that's a great question, Mason. So as you mentioned, what we had observed and really practiced during the COVID-19 pandemic was anyone over age 6 months and older at that time was eligible and indicated to get a COVID-19 vaccine. With the updated indications coming out of the FDA in the past couple of weeks for the 25-26 COVID-19 vaccine, we've seen the indication has been approved for any adult over age 65 years and older.
Right.
And then for those that might be age 6 months to 64 years who have an underlying condition that puts them at higher risk for coming down with severe COVID. So some of those higher risk conditions can be things like cancer, can be kidney disease, and can be physical inactivity. So
any of those count as an underlying condition, including just lack of physical activity. If I'm just very lazy, I could argue that that's a reason to get the vaccine.
Yeah, and I wouldn't even say lazy. I would say, let's say you have a job that really prohibits you from getting a lot of activity, or you have a condition that you can't really move about very easily, or some other ability that is impairing you. Any of those really would put somebody at a higher risk for developing severe COVID, and we'd want to protect them from coming down with something like that. So getting a vaccine for those patients is going to be very important. So with the updated indication that FDA released not too long ago, we're seeing that, yes, it is limiting in comparison to what we observed during the COVID-19 pandemic, but we should still have a decent number of patients that we can protect directly given the indication itself.
So it's not all bad. We do have some protections available, and there are a lot of underlying conditions that can be counted as COVID appropriate, I guess is what you'd say.
Yeah.
Okay.
COVID vaccine appropriate or indicated for them to get the updated COVID vaccine because of those conditions that put them at higher risk for coming down with severe COVID. In fact, estimates have shown that about 75% of Americans should be eligible to get the updated vaccine based upon what those underlying conditions are.
Okay, so it's not as bad as it sounds on paper. We do have a lot of leeway in terms of who can get covered, because for better or worse, I guess a lot of people do have one condition that would work towards their favor here.
Yes, exactly. I mean, we see a lot of chronic disease in the United States, and most of those are going to put somebody, unfortunately, at a greater risk for severe disease. And those are the patients we want to protect the most. One thing I would also say around this topic is I've heard a lot of people saying, well, how do I let my pharmacist or my doctor know that I have an underlying condition? Do I have to get a piece of paper? Do I have to have a note sent over?
Sure.
No.
No?
You can self-attest.
Oh, okay.
So you can go into your pharmacy and say, my name is Bridget and I have this condition, mark it on your form, and that is sufficient to say to your pharmacist that you should be eligible for getting the updated COVID vaccine.
Okay, so there seems to be a lot of flexibility around how we can kind of justify getting our vaccines to us either through a prescription or other manner. So back when Operation Warp Speed was implemented, we had everybody and everyone recommended get the vaccine as soon as you can, as quickly as possible, protect yourself from COVID. Now we've got these new regulations or indications, from the FDA saying only those over 65 or with an underlying condition. And we've had significant and unprecedented ACIP actions as well for the COVID vaccine. So that's a lot to navigate. How are we really supposed to make sense of this confusion? Like, how are we supposed to navigate the confusing world of vaccination and immunization right now?
Great question. And maybe what I want to do first is to start by saying what typically or traditionally has been the process. And this in particular also occurred during the COVID-19 pandemic, meaning our FDA would meet, they would review and evaluate the safety and efficacy data, the raw data from the studies, and identify which patient population should be indicated to receive the vaccine. In this case for COVID, at that time, it was for all of our, patients over the age of 6 months, as we've described. Then that information would be taken to the ACIP for their committee and their work groups, the scientific advisors, to look at this information, to look at the data, to compare against some of the recommendations from the FDA and see, is this really based on clinical evidence, what we should be doing and what we should recommend?
Sounds like a government peer review almost, where there are checks and checks and checks.
Yes, exactly. And then the final check in that process is the CDC director reviewing that and then putting their endorsement and signing off on it, so it would be either added to the schedule or come out with a recommendation. So those processes, as we've talked about before, were not skipped. They were conducted in exactly that order and in that fashion during the pandemic. So with the updated vaccines for this season, similarly, those steps should occur. Where we're seeing some challenge and maybe where some of the confusion is coming out is because the timing with which this is occurring is truncated. Typically, we would have seen the FDA meet and talk about this in the spring. They just met and talked about it just a couple of weeks ago. At the time, we didn't know if ACIP was going to meet and discuss an updated recommendation for the COVID-19 vaccine. Since then, they have announced that in mid-September, so in just next week, they are going to be meeting and hopefully should be discussing the updated vaccine for COVID and indicating and issuing a recommendation that ultimately, in this case, as we don't currently have a CDC director, would be signed off or supported by the HHS secretary or their delegate that they might be appointing in the meantime.
So we have the guidelines from the FDA, and then ACIP is going to be meeting on these in the near future to hopefully distill that into something that doctors and the scientific community sees as more effective in terms of kind of distributing these vaccines? Is that what we're thinking?
Yeah, more like they base it on clinical need, looking at how they're going to distribute it to the patients that are of most need, and where is it going to make the biggest benefit for our patient population. But it is not unheard of for them to have something different. We don't know exactly what we'll see come from this upcoming ACIP meeting as far as recommendations, but likely will be aligned with what the FDA has already indicated, meaning our older adults over age 65, and then those 6 months to 64 years with the underlying condition.
Okay, so if we're not expecting much of a change here, what if we are just the prime picture-perfect body of health, where I'm an Adonis, I have no issues, so I don't fall into either of these FDA guidelines of having an underlying issue or being older than 65? Or being younger than 6 months, but they're not approved. So what do I do then? Can I even get an updated version of this vaccine, or am I just out of luck?
We see a lot of patients fit into that age group, or that they don't have an underlying condition in that age group, that might be caring for individuals who are at high risk. Perhaps they have a family member that's an older adult and in less than ideal health, or perhaps they're caring for a child that unfortunately has some severe condition, cancer, or other immunocompromising condition. They want to be protected for themselves, but to also protect the loved one that they lived with or that they are currently living with and caring for. So if somebody does not fit within that specific FDA indication, when they either receive a medication or in this case, the vaccination, it's considered off-label. That isn't a completely out of the norm practice. Okay. We do use medications and vaccines off-label if we have some evidence and scientific show back that it is safe, that it is effective. Given in this case that we saw during the COVID-19 pandemic, as we've talked about, every American was eligible and encouraged to get one. We know that while individuals who are otherwise relatively healthy may themselves not necessarily be at higher risk, but the work or the people or those that they engage with around them might be, and they want to protect themselves accordingly. It's technically, as I said, off risk, or off label, but it is within the limits and it's appropriate for that person to get it.
So for those who don't know, not me because I know everything, but off-label in this regard would be those who just don't fall into the recommendations, so they have to find access outside of the recommendations for COVID vaccines?
Sure. Yep. That's a great way to summarize that. And so what we're seeing is that either via a prescription or going to your doctor's office is going to be the best choice right now, at least for those individuals. That said, we're seeing to add to some confusion, we're seeing some other organizations that have been longstanding clinical issuing organizations. They have guideline setting regimens. They're coming up with other recommendations that do indicate that all patients should be eligible to get it. And then given different states' authority and how they're modifying things for access at a pharmacy or via your primary care office or other location in your state, then it is going to be okay and acceptable for those patient populations to get that. So we're seeing opportunities and access doors open as we continue to navigate between these variety of different issuing agencies and organizations.
This has got to be the first time in quite some time where I've found that being healthy can actually work against you in a sense. But it's sounding from what you're telling me that even if you are the perfect specimen of health, you can find a way to have that reason to get the vaccine,
yes,
either off-label or within the recommendations. Mm-hmm. So one way or another, you can cover yourself. It just may be a bit more nuanced than usual.
Exactly. Yeah. And what I want to also offer is that, in particular for APhA, one of the areas that we're doing and working on is helping our states for pharmacists and pharmacy locations in particular to modify protocols that they might have at their individual pharmacies, or working through our state pharmacy associations and helping them to navigate either rule or regulation changes at the state level to continue reopening those access doors to anyone that really truly needs or wants a COVID-19 vaccine.
Okay, so that's great. And that works as a good segue to my next question. What is APhA actually doing to help this transfer, I suppose? So we're working with policy at the state level to make it, I guess, simpler or at least easier to follow for pharmacists to dispense the medications that their patients need.
Yes. So when we first started with the COVID-19 pandemic, and even before, we saw that states had specific protocols or have within their state scopes of practice, the way that their rules and regulations are composed is that the pharmacist would be authorized to vaccinate for either the medications or the vaccines that are listed on the CDC schedule, or
right, like they're the primary resource for vaccination for a lot of Americans right now.
Yes. So we're expanding that in those states to recognize other credible and reputable issuing organizations and associations. So thinking about some of the data and evidence that has come to light in the past couple of months, in particular for fall respiratory virus season, making sure we're taking that evidence, coming up with a recommendation that's appropriate, and then being able to facilitate that through a state scope or regulation change specific to that vaccine itself.
Okay, so it sounds like we have the ball rolling in terms of how to work within your specific state guidelines, how to dispense specific medications to people who hopefully fall in these guidelines. And then from there, as we get more information from the upcoming fall to winter surge of COVID and other diseases, as well as any other sicknesses that come down the line, we'll just have to simply kind of pivot and be flexible in terms of where the recommendations go from there. Yeah.
And Mason, one of the things that is going to hopefully help to alleviate any future issues is specifying within these modifications for opening it up to any reputable or credible organization that issues a recommendation. As many of the states right now had specifically called out CDC or ACIP, it limited them to, in particular for pharmacists, on who they could vaccinate. But by expanding that, by putting additional credible organizations on there, we should see that would prevent any issues coming forward because we have multiple agencies and issuing groups to fall back on of, okay, this patient fits in this patient group, and because of the data and evidence and the scientific backing we have, and because our protocol was written accordingly, then we can go ahead and vaccinate that group as deemed fit, going forward.
So that really is a great segue into my final question here in terms of what is the pharmacy profession's next step here towards making a healthier country that is protected from COVID and other diseases? We have these differing opinions from federal agencies, differing opinions from the scientific community. What is our next step here?
Great question, and there's a lot of opportunity to work together. So APhA is leading our national pharmacy organizations and associations to work together as an entire unit to really represent the profession. We're working with physicians and other healthcare clinician types to assure that role of the pharmacist as part of the overall healthcare team is present, and then working with patient groups and patient advocacy experts on how to assure that patients can still access their needed vaccines and, of course, their medications from their local pharmacist. We have offered webinars as well as other recordings and resources from the pharmacy professional work group that we have been comprising and working through, from working with other clinicians and physicians, really making sure that as a team, we can help to overcome whatever barriers that patient might have when they're trying to access a vaccine during these times.
Right, because you're all working towards the same goal of providing care for patients. Like one way or another, that's the goal at the end of the day.
It is. And I really want to end on that is ultimately, pharmacists became pharmacists. Technicians and other team members are working for the ultimate goal of being there for their patients and providing that utmost ideal patient care and being that source of information, truth, and the location where they can receive their updated COVID-19 and all other vaccines.
Dr. Bridget Groves, thanks for being on our X Report. We loved having you.
Thank you.
And if you were curious about more of what Dr. Bridget Groves had to say on future immunization practices, then leave us a like and subscribe. Leave a comment on anything that she was saying today and let us know your thoughts. But until next time, our executive producer is Rob Hodges. Our creative producer is Kate Erdmann. And until next time, I've been your host, Mason Manuel. Be sure to tune in next Friday for more RX Report, where you get your health, your news delivered. But till then, bye y'all.